I'm Dr. Gary Clayman of the Clayman Thyroid Cancer Center of Tampa, Florida. In this video, we're going to talk about you've just gotten a diagnosis of thyroid cancer. Do I need to be in a hurry?
That's really what I want to talk about today. So, just found out that I got a thyroid cancer. I had a nodule. We stuck a needle in it. It turns out it's cancer. I'm freaked out. I got this thing in there. It's cancer. I want it out. I want it out yesterday, and I'm freaked out. I can't sleep. Every time I look in the mirror, I'm looking at my neck. Okay, am I doing the right thing? Am I freaked out for no reason? Do I need to be in a hurry? Do I need to get this thing out next week? Because that's how I want it. I want it out now.
So don't be in a hurry, okay? In 99+% of cases, surgery is not a hurry. You need to sit back and relax. In the 1% or less of patients that have the worst type of thyroid cancer called anaplastic thyroid cancer, that's the only time I want to get to the patient into the operating room yesterday. Otherwise, you need to get all the information. You need to find the best of the best to take care of you, and you need to be appropriately evaluated, and then you proceed with your surgery. It may even be you just wait. You may have your anniversary 2 weeks from now or 3 weeks from now. Don't be in a hurry.
So, I mean, I think it's just human nature, but it's my human nature. I'm so freaked out. I want it out. And so I'm reading it, and everything, the more I read about it, the more I'm freaked out, the more I'm scared, the more I think I'm going to lose my voice. But I also understand that just because I've got this nodule and they got the cancer, it's probably been there for years, right?
Right.
It's been there for a long time.
Right. And so, in fact, many patients, just like you, will have had this nodule, and then they go back and they see it on the CAT scan that they had because they had something else looked at years ago. And they'll see it was there back then. Even sometimes these are followed by your doctors over a period of time, and they just slowly grow. So we know that they did not just come up overnight, except in those very rare patients that we already talked about. So we're not talking about that.
So I don't have days to figure this out. I've got weeks or months, okay? So I can take 2 weeks to 3 weeks to find a new endocrinologist. I can take 2 or 3 a month to find the surgeon. I'm not in a big hurry.
Let me put this in this perspective. If you were a young woman in your mid-30s and you were pregnant, I may wait till the end of your 7 or 8 or 9 more months of pregnancy. After you've breastfed, I may wait a year before I do your right thyroid cancer.
Well, that really helps me understand, because so I don't need to freak out. I've got time. I can find the right endocrinologist who's going to follow me for years, as we've talked about, and I'm going to find the right surgeon who's going to operate me, cure me the first time, not the second time. So I've got time to do all this stuff.
Exactly.